It's time for us to face the reality of antimicrobial resistance and recognize it as one of the greatest global threats to public health. 700,000 people lose the fight against resistant microbes every year. And unless drastic measures are taken to contain the spread of resistance genes, antimicrobial resistance could kill one person every 3 seconds by 2050. Resistance genes can be found everywhere, in the food we eat, in the water we drink, or in the air we breathe. While regulatory bodies all over the world are focused on finding solutions to reduce antibiotic consumption, both in humans and animals, they neglect to address a key cause of antibiotic resistance, namely pharmaceutical pollution. At Healthcare Without Harm Europe, we work to transform the healthcare sector so it becomes more environmentally sustainable. We believe a holistic approach is needed to tackle antimicrobial resistance and that we all have a role to play in the battle against this global public health crisis. The health sector contributes to environmental pollution, which leads to antimicrobial resistance through, for example, poor waste management practices or unhealthy food choices in hospitals. On the other hand, healthcare professionals can influence patients' use of antimicrobials, and they should be actively involved in reducing their misuse and overuse. For example, doctors can optimize prescription practices to ensure antibiotics are prescribed and dispensed prudently. Pharmacists are also well placed to advise patients about how to follow the correct therapy of antibiotic drugs and help reduce the risk of accumulating unused antibiotics that become waste and can end up in the environment. With the moral imperative, do no harm in mind, the healthcare sector can lead an example for other sectors in tackling antimicrobial resistance. So join our Safer Pharma campaign today at saferpharma.org and find out how you can help reduce pharmaceutical pollution that leads to antimicrobial resistance.